My name is Boris Malyugin. I'm from Moscow, Russia. I'm practicing in S.Fyodorov Microsurgery institution. The ideal case for Malyugin Ring 1, or for the classic version, is the patient with small pupil, like very small, from inflammation, from some inflammatory conditions such as previous glaucoma surgery or trauma, when the pupil having extensive posterior synechia and the iris is rigid and it's really hard to open it, and sometimes I even do first some pupil stretch in order to expand the pupil from 1 millimeter to 3 and then insert the Malyugin ring. So this is probably one of the ideal candidates for the classic one version. And for the second, it's the patient with intraoperative floppy iris syndrome, and usually I use 70 millimeter ring, which gives you a better opening, better access to the iris, and also because we know that sometimes in intraoperative floppy iris syndrome pupils are bigger from the very beginning, it's so much easier to engage the 7 millimeter ring into the iris and have a good hold of the iris tissue. Challenging case was when I was using femtosecond laser, and the patient comes to me and the pupil constricts very significantly, and I was planning, apart from removing the cataract, I was planning to place a toric IOL, and this was a patient after PKP with a very high astigmatism, 12 diopters, custom-made toric lens, so I really need to position it absolutely properly and align. And in this case, one of the challenges is when you're implanting the ring after capsulorectus is being done, is not to catch the capsule. And for that, I do so-called picture frame maneuver. I try to move the ring in different directions. And actually, if it's not engaging the capsule, it's really moving very easily. But when you stuck in some meridian, then you can understand that you really catch the capsule, and then you have to disengage and engage it once again. Yeah. Cataract surgery is one of the most rewarding surgeries in our profession, and you have a very good feeling about that, because you actually taking a patient from 0 or very low vision to almost 20% vision, and that's you know that next day you will see this patient and he will be smiling, he will be thanking you, and that's emotionally it's a very rewarding surgery. And I don't know, because some people love emotions, some having good emotions from skiing, some of them from driving a big car, some of them maybe from eating candy.